A 3-year-old child is brought into it by his parents with a widespread itchy rash. The patient is otherwise generally well, other than a mild temperature and irritability secondary to scratching and poor sleep. The parents explain that the rash started as pink spots which became blisters which then became raw. You note some of the lesions are crusting over. Which of the following is the most likely infectious agent? Options are A. Measles virus, B. Parvovirus B19, C. Rubella virus, D. Varicella zoster virus, E. Epstein-Barr virus. The answer is D. Varicella zoster virus. The patient most likely has chickenpox caused by the varicella zoster virus. A 8-year-old unvaccinated girl, originally from Hungary, is brought to the emergency department by her parents who are concerned about a non-itchy rash. She has been off school with a cough, conjunctivitis, and a high temperature for the last couple of days, and the rash started this morning, appearing first behind her ears and traveling down her trunk. Given the suspected diagnosis, what is the recommended school exclusion advice? Options are A. After 24 hours of fever, B. Once the rash has completely gone, C. 4 days from the onset of the rash, D. 4 days after the rash has gone, E. Once mucosal involvement has resolved. The answer is C. 4 days from the onset of the rash. The diagnosis is most likely measles. Advise patients that measles is usually a self-limiting condition that will usually resolve over the course of about a week. To rest, drink adequate fluids, and take paracetamol or ibuprofen for symptomatic relief. To stay away from school or work for at least 4 days after the initial development of the rash. Ideally until full recovery to reduce the risk of infective complications. To avoid contact with susceptible people, that is, people who are not fully immunized through